What if the key to lowering your blood pressure wasn't in your medicine cabinet, but in your refrigerator? What if 5 common foods you probably walk past in the grocery store every week, could start dropping your numbers within just 7 days? The science behind this is remarkable, and I'm about to share exactly which foods these are. If you're lying awake at night worrying about high blood pressure, feeling anxious before every doctor visit, or tired of medication side effects, you're not alone. 75% of adults over 60 are taking blood pressure medication, yet many still can't get their numbers under control. In today's video, I'll reveal 5 scientifically backed foods that can naturally lower your blood pressure, improve your circulation, and support your heart health. Some of these foods might already be in your kitchen, but others might surprise you. Before we start, I'd love to know where you're joining me from today. Leave a comment below and don't hesitate to ask any questions that come to mind. And if you're passionate about natural health solutions, make sure to hit that subscribe button. Your healthy living journey starts here. Food 1. Beetroot. Beetroot is considered nature's blood pressure lowering superfood. But why? Beetroot is packed with natural nitrates that your body converts into nitric oxide. Nitric oxide relaxes and widens your blood vessels, improving blood flow and lowering blood pressure. In one study, elderly adults experienced significant drops in blood pressure within just 6 hours of drinking 1 glass of beetroot juice. This effect lasted for 24 hours. Think about it. With just 1 glass of juice, your body naturally starts regulating blood pressure. The biggest advantage of beetroot is that it lowers both systolic and diastolic blood pressure. Systolic is the pressure when your heart pumps, diastolic is when your heart rests. Having both at healthy levels is critically important. How should seniors consume beetroot? If you prefer beetroot juice, 250 milliliters daily is sufficient. If you like fresh beetroot, boil it, roast it, or eat it raw in salads. If you're bothered by beetroot's earthy taste, you can soften the flavor by mixing it with orange juice or apple. There's one important point to note. People with a history of kidney stones should consume beetroot in limited amounts because of its high oxalate content. If you're taking blood-thinning medication, consult your doctor before starting regular beetroot consumption. Food 2. Garlic. Garlic has been known for its healing properties for thousands of years, but its effect on blood pressure has been scientifically proven in recent years. The allicin compound found in garlic relaxes the walls of blood vessels and facilitates blood flow. Research shows that regular garlic consumption can lower blood pressure by an average of 10 to 15 millimeters of mercury. This is equivalent to the effect of some medications. This effect is particularly pronounced in people over 65. How does garlic's effect on blood pressure work? Allicin increases nitric oxide production and also affects calcium channels in blood vessels. This makes the vessels more flexible and leads to a drop in blood pressure. For the most effective garlic consumption, you should crush or finely chop fresh garlic and wait 10 minutes. This time is necessary for allicin to activate. 1 to 2 cloves of garlic per day is sufficient. Consume with food to avoid stomach discomfort. Garlic supplements can also be effective, but aged garlic extracts are better tolerated and don't cause heartburn. If you're taking blood-thinning medication, garlic is also a natural blood thinner, so medical supervision is important. Food 3. Dark leafy greens. Spinach, kale, arugula. Dark leafy greens are true superheroes when it comes to lowering blood pressure. Vegetables like spinach, kale, and arugula are extremely rich in nitrates, potassium, magnesium, and folate. The combination of these nutrients creates a synergistic effect on blood pressure. Nitrates, like in beetroot, convert to nitric oxide and dilate vessels. Potassium regulates sodium balance in the body and helps the kidneys excrete excess sodium. Magnesium works as a natural muscle relaxant and ensures the heart muscle works more regularly. According to one study, elderly people who consumed at least one serving of dark leafy greens daily had 15% lower blood pressure than those who didn't. This effect starts to be seen in just a few weeks. What's the most practical way of consumption for seniors? Add a handful of spinach to your morning smoothie. You won't taste it, but you'll get the benefits. You can consume it as salad at lunch, lightly sautéed at dinner. Frozen versions are equally beneficial. Spinach and other leafy greens are high in vitamin K. This is important for those taking blood thinners like warfarin. Regular consumption is preferred over sudden increases. Those with kidney problems should also consume under medical supervision due to potassium content. Food 4. Fatty fish rich in omega-3: salmon, mackerel, sardines. Fish rich in omega-3 fatty acids are very powerful tools for lowering blood pressure. Omega-3s known as EPA and DHA reduce inflammation in blood vessels, decrease blood viscosity, and regulate heart rhythm. Clinical studies show that elderly people who consume fatty fish at least twice a week have 4 to 5 millimeters of mercury lower blood pressure. While this seems like a small change, it reduces heart attack risk by 14% and stroke risk by 9%. How does omega-3's effect on blood pressure work? These fatty acids regulate prostaglandin production. These molecules control blood vessel dilation. They also regulate heart rate and make blood vessel walls more flexible. The best choices for seniors are small fish, sardines, mackerel, anchovies. These fish have both low mercury levels and high omega-3 ratios. Salmon is also an excellent choice, but prefer wild-caught varieties. If you don't like eating fish, fish oil supplements can also be effective. 1 to 2 grams of EPA plus DHA daily is sufficient. However, if you're taking blood-thinning medication, omega-3 supplements can also affect blood clotting, so get medical approval. Food 5. Coconut water. Coconut water is known as nature's sports drink and is surprisingly effective at lowering blood pressure. Extremely rich in potassium, coconut water regulates electrolyte balance in the body and increases sodium excretion by the kidneys. 1 glass of coconut water contains more potassium than a banana, approximately 600 milligrams. Potassium works opposite to sodium. While sodium raises blood pressure, potassium lowers it. This balance is disrupted because modern diets consume too much sodium and too little potassium. In a 2012 study, hypertension patients were given 2 glasses of coconut water daily for 8 weeks. The result was surprising. Systolic blood pressure dropped an average of 7 millimeters of mercury, diastolic blood pressure 4 millimeters of mercury. The advantage of coconut water is its rapid effect. A drop in blood pressure can be seen even 2 to 3 hours after consumption. This can be particularly beneficial when blood pressure suddenly rises. Consumption recommendation for seniors: 250 to 500 milliliters coconut water daily is sufficient. Consumption in the morning or after exercise is ideal. Choose natural versions without added sugar. If you're diabetic, control portions due to natural sugar content. Those with kidney disease should be careful. Coconut water has a very high potassium ratio, so it can cause potassium accumulation in those with impaired kidney function. Bonus tip: nutrition timing secret. When you consume these 5 foods is also critically important. Here's the schedule that maximizes the blood pressure lowering effect. Morning. Start the day with coconut water. Dehydration raises blood pressure, so morning hydration is important. Pre-lunch. Green leafy vegetable smoothie. The effect of nitrates peaks in 2 to 3 hours. Lunch. Fatty fish as main course. The anti-inflammatory effect of omega-3s balances afternoon stress. Evening. Meal containing garlic and beetroot. Helps keep blood pressure stable throughout the night. Important point. To see the effects of these foods, at least 7 to 10 days of regular consumption is needed. The body needs time to adapt and establish natural balance. Conclusion and call to action. There you have it. 5 powerful foods that can naturally lower your blood pressure. The nitrates in beetroot, allicin in garlic, potassium in greens, omega-3s in fish, and electrolytes in coconut water. All working together to help bring your blood pressure to healthy levels. This isn't just a menu, it's a strategy. Blood pressure problems aren't random. They're usually your body's way of signaling nutritional imbalances, chronic inflammation, or electrolyte deficiencies. This list doesn't offer short-term solutions with medications. It allows you to naturally solve problems by nourishing your body with what it really needs. Remember, each of these foods plays a role, but together they become a holistic nutritional solution to one of the most common health problems faced by seniors. If you found this video helpful, please don't forget to hit the like button. It really helps us bring you more valuable content. Leave a comment below and let us know your thoughts, questions, or topics you'd like us to cover next. We love hearing from you. Of course, click the subscribe button and turn on notifications so you never miss our latest health tips and insights. Stay informed, stay healthy, and see you in the next one.